talking a little bit about how you can use intravenous nutrition to improve your health. But before I get into that, I wanted to, for those of you that have never been here before, I thought I would just give just a little background on the Riordan Clinic. And for those of you that have been here before, how many of you are hearing for the first time that we've changed the name to the Riordan Clinic? Several of you. Okay. All right. Well, we were founded in 1975 based upon a vision of Olive W. Garvey, who was a philanthropist here in Wichita, who had the insight that, and I always say it would come from a woman, that she would realize that we've got to do more with nutrition. And so she was hoping that she could find someone who would help her open a laboratory in order to test nutrient levels in patients who were mentally ill. And so Dr. Hugh Riordan, who was a practicing psychiatrist here in Wichita at that time, he too had begun to shift his thinking towards the underlying causes. What are the underlying causes of mental illness? And began to realize that nutritional imbalances were a major part of that. And as fate would have it, the two of them got together and through the generosity of Mrs. Garvey and actually many people in Wichita, Dr. Riordan was able to create the Center for the Improvement of Human Functioning, which has been the name of the center for over 35 years. We've had a number of little side names like the Bright Spot for Health, the Pyridomes. Some people just refer to us as the center. But unfortunately, a lot of people didn't know what we did here, and for many people in Wichita, it was even a surprise that we were medical in our orientation and dealing with chronically ill patients. And so, just earlier this year, Dr. Riordan's youngest son, Brian Riordan, became our CEO, and in thinking about what we needed to do to make ourselves better known in the community, and in honor of the work that Dr. Riordan did in pioneering Mrs. Garvey's vision, we changed the name of our facility to the Riordan Clinic. And so our mission has evolved also in some very interesting ways that I want to just spend a moment kind of going through that with you. There's basically two different care tracks that we have here at the center. This chronic care is what we've always been involved with, and this was how the center got started. People who had had a chronic illness or who had been to many physicians and had not gotten the results that they hoped for would come to the center, and we would use our laboratory, the BioCenter laboratory, which is now the Riordan Lab. And the main thing we would do is look for underlying causes. Why is this person continuing to be ill? And what can we do to correct those causes in order to help them regain their health? And one of the things that distinguishes us from most medical facilities is that we encourage you to be part of the detective process with us. We wanted our patients to become co-learners, and so there's a very strong educational component to what we do here at the center in terms of encouraging you to read and to become involved in this discovery process. We use the lab to determine your biochemical underpinnings that may be out of balance, that may be part of the reason why your body's not becoming well. And the overall goal was to improve human functioning, and we still are interested in improving human functioning, but I'm going to say that this was somewhat of a reactive approach in the sense that the people that were predominantly coming to see us were already sick, had been sick for an extended period of time. It's not that we didn't see people who were well wanting to be healthier, but the predominant nature of what we did involved a chronic care, shall we say, reactive pattern, reacting to the fact that the illness was not going away and the understanding of why that individual was ill was not clear. Well, we still are doing that, and there's no lack of people who are having problems figuring out why they can't get their energy back, or why they continue to have infections, or why they have autoimmune diseases. So that's still going to be a very dominant part of the center. But today, we want to talk a little bit about a whole new dimension of how the center is growing and evolving in its mission to create an epidemic of health. And so I want to introduce to you the new track that the Riordan Clinic is undertaking, and that is lifestyle care. And lifestyle care, the focus is shifted. The focus is more focusing on what you can do for your health. And I've always liked the term health building, or building your health, looking for new ways to help you find out how you can make better choices in order to be healthier. And so this falls under the category of self-care. Not that we want you to go out there completely on your own. I think it's good to be working with a health care professional that can help coach you, can give you some guidance and help you stay safe in the process. But part of what we're doing here is in the same way that a personal trainer would help you with an exercise program, we're here now to help you with lifestyle training and revision, making changes that will help you make better choices in order to be healthier. The reason I think this is timely is that I'm a co-author of a book on prediabetes. Prediabetes really is just a new term for the metabolic syndrome, which means people who are gaining weight, or their blood pressure is going up, or their cholesterol's now, or lipids are going out of control, or they're tired, they're having problems with their blood sugar. These are all signs that the basic metabolic functioning of the body is out of balance. And there was an article in the Wichita paper a couple weeks ago on the estimate now is that 50% of Americans have at least one or more of the symptoms of prediabetes. And certainly weight, the people are having a hard time figuring out what to do about their weight. Energy seems to be, there's an energy crisis along with every other crisis that's going on in our world. And so the theme of the lifestyle care is for us to become more proactive. If you're starting to feel bad, rather than waiting until the chronic illness emerges, whether it's a heart attack or a stroke or some other health crisis, these signals are actually the body telling you it's time to make some changes. It's time to do something different that will help you make the better choices. It's going to put you in a better state of health. So just to give you some examples of the types of conditions, the chronic care track would be more serious illnesses like cancer, active heart disease, severe migraine syndrome, chronic fatigue syndrome, ulcerative colitis, schizophrenia, autoimmune disease. Maybe it's just a mystery illness. So you've been ill and no one can figure out why you're sick, or you've had a long-standing illness for which you've consulted on many specialists and have been unable to figure out what to do. That's our chronic care track, and that's how we have functioned for the last 34 years. But starting in this year with the renaming of the center, we want to let people know that before they become seriously ill, if they are beginning to have signs and symptoms and conditions that are arising that indicate that the body's not functioning up to par, such as high blood pressure, weight going up, low stamina, high cholesterol, prediabetes, stiffness and achiness, stress, mild depression, and in a word, not well but not completely ill. A lot of the people that I think can benefit the most from the lifestyle care track are people who are still working, still functioning, but have lost that zest, have lost the energy and the enthusiasm that normally we associate with health. And I'm reminded of Dr. Riordan's definition of health. The health is having the reserves to do what you need to do and want to do with energy and enthusiasm. So he was talking about this track, but we hadn't developed it until just recently. So today what we're going to be talking about is one of the components of the lifestyle care track. Things that you can do before you become seriously ill that will help kind of get you back into the swing of things. And so today we're going to talk about the IV nutrition advantage. And so IV stands for intravenous, or through the vein. And so why would it be beneficial for someone to do nutrients through the vein? How could that help them begin to reestablish this improved functioning, this better level of health and well-being? Part of what we want to do today also, I have Jeannie and Carrie here are two of our nurses, and they're going to actually do an IV nutrition infusion today so that we can demystify it and so you can see that it's really very safe and very easy to do. So Jeannie's going to be our IV receiver, and Carrie's going to do the IV honors today. So while I'm giving my talk, they'll be doing an IV up here. And you'll find out a little bit more of what this involves as I get a little further along in the presentation. So if you look to conventional medicine and you try to answer that question, who should do IV nutrients? Well, that would be someone who is really pretty darn sick, when their oral intake of key nutrients is insufficient to meet their cellular needs. And these would be people who cannot swallow, or their eating has been compromised, such as an unconscious trauma victim, a patient with extensive facial burns, maybe a patient who has been receiving chemotherapy and they're extremely nauseated and cannot eat. And so these are all obviously very good reasons why people would need to have some kind of IV nutrition in order to keep them alive. What we're talking about here is using IV nutrition in a different way. And I'm going to introduce a word to you, the orthomolecular way. And I'll explain that in just a minute here. It turns out that you can use IV nutrition as a means of rapidly correcting nutritional deficiencies that may be present at the cellular level. So we like to think of the IV nutrition as outpatient cellular medicine. What do your cells need that they're not getting enough of that might be contributing to why you're not feeling as good as you could feel? And so IV nutrition means using the right molecule. And when we say the right molecule, these are nutrients or molecules that naturally occur in the body. So I'm going to explain to you what the nutrients are that Jeannie's receiving. But these are things that you get in your food, but we're doing them at a dosage that you cannot achieve just through food and oral supplementation alone. And so this is a way of taking deep cellular deficiencies and rapidly correcting them so as to overcome cellular malfunctioning. Now, this was not just our idea. Dr. John Myers was a medical doctor from Baltimore who over 30 years ago had this thought. He began wondering if his chronically ill patients might be suffering from a form of hidden malnutrition. Did they have this cellular deficiency that could not be overcome by oral administration alone? And so where would he have gotten this idea? Well, it turns out that after World War II, there were a number of people that came back from concentration camps that had been in captivity for as long as 44 months. And they had lost a lot of weight, and they had all the diseases of malnutrition that you can imagine in a concentration camp environment. They had scurvy, which is a lack of vitamin C, beriberi, which is a lack of B1, pellagra, which is a lack of vitamin B3. They had chronic infections, they had calorie and protein malnutrition. So they were very ill, they survived, they were put through rehabilitation, but they continued to suffer from a variety of physical and psychiatric conditions that oral nutrition was not enough to overcome. And so now Dr. Hoffer began to wonder if there was something that had changed in their cellular biochemistry that made them require more than what they could get from just eating a balanced diet or taking just regular vitamin supplements. And so he began to think about this term, nutrient dependency disease. And there were 12 of them that instead of just being given multivitamins and good food, they were also given very high doses of niacin, about 3,000 milligrams per day. I don't know if any of you here have taken niacin, but there's a pretty significant flush that goes along with taking niacin. And so for these patients, they had to endure for several weeks the flushing that is typical of high-dose niacin. But the good news is that after they had been on this for a period of time, their symptoms resolved. And as long as they stayed on the high dose of niacin, they continued to recover from their illnesses and do well. But if they went off the niacin, they began to have recurrence of their symptoms. And so this is where Dr. Hoffer thought these patients not only had a nutrient deficiency, but they because of the stress of the concentration camps and the severe malnutrition that they suffered from, they had developed a nutrient dependency disease. So this, just to redefine this, it's prolonged and severe malnutrition that can cause changes in the victim's cellular biochemistry. So recommended daily allowance dosages, which we would say, just eat a balanced diet or maybe take a multivitamin, that would have been insufficient to meet their nutritional needs. Many chronically ill patients develop a need for much higher dosages of key nutrients in order to correct and maintain cellular health. And over the 34-year history of the center, what we have done is worked with patients who have developed chronic illnesses that no one seemed to be able to help. And they had undergone, we asked patients to go see their doctor, see your specialist, do everything you can from a conventional perspective. If you're not getting well, then we're suspicious that maybe you have a greater need for key nutrients than what just an average diet will provide. And that's where our testing in the BioCenter laboratory has demonstrated this over and over again. And so today, when we're talking about IV nutrition as a lifestyle care therapy, it's a way that the average person as well, if you have chronic symptoms, may be able to more quickly overcome this type of nutrient dependency condition. So what would be some typical examples of this? Migraine headaches. And these were patients that Dr. Myers in his practice in Baltimore took care of. Chronic fatigue patients, patients with severe allergies, heart disease, recurrent angina, acute asthma attacks would respond to an IV infusion like what we're doing over here. Fibromyalgia, which is a chronic condition of muscle achiness, fatigue, and other symptoms. And anyone with recurrent infections, especially respiratory and sinus infections. These were conditions that he found responded very well to one of his infusions. Now, where he thought the origin of this came from, he found that a lot of the patients that he saw had a lot of digestive problems, either bloating and gas, indigestion and gastritis, or even irritable bowel and colitis. And I don't know if you know, but the most commonly prescribed medications in the world are the digestive medications, whether you're talking about antacids or acid blockers of various sorts, antispasmodics. And so digestive problems are very common in our culture. So Dr. Myers was wondering if these patients were actually suffering from a type of chronic malabsorption of these important nutrients that were leading them into vitamin dependency conditions. So he developed this, I don't know if he called it this, but many people who came to get the infusion called it the Myers cocktail. And that's what Jeannie is getting right now. It's a blend of vitamin C, calcium, magnesium, vitamin B1, vitamin B6, B5, B12, and B complex. So it's just a blend of nutrients that you can get in a multivitamin, except you can't get it in these dosages. Or if you tried to take this amount of vitamin C orally, it might very well cause some gastric upset or some diarrhea. So he found that he could use the IV nutrition in these severely disabled patients, and he began to see that if he had them come on a regular basis, what was a therapy-resistant illness would begin to improve. So I know, and I'm sure the doctors here know, that most doctors have patients who have become their chronic patients. These are patients that you can use medicine, you can treat the symptoms, but the condition never does seem to go away. And maybe some of you have symptoms like that you've wondered, what's the deal? Why have I not been able to get better? And what we found here at the center is very often people do have nutrient dependency conditions that may require higher amounts of nutrients than what you can get just from oral supplementation. So Add to this the fact of stress, because very often when people are chronically ill, they're chronically stressed, or you don't even have to be ill these days to be pretty well stressed. And it's been shown that when you're under stress, you tend to deplete your nutrient reserves. And this is why people who have gone through maybe a job loss or a death in the family, down the road someone will say, gee, it looks like you've really aged. And then what we call aging very often is a loss of nutrient reserves. So if you combine chronic stress with digestive inflammation, which is really at the root of many of these chronic digestive problems, leading to intestinal malabsorption, all of these things set you up for not getting the nutrients that maybe your cells really do need in terms of functioning normally and being well. And so this sets people up for cellular malnutrition. And the only way to know if you have cellular malnutrition is to test for it, or what we're hoping here is that if people are suspicious of that, they can use, under a doctor's supervision, IV nutrition as a way of helping to resolve that. So in our culture, though, in our medical culture, nutrition is not typically taught to any significant degree in the medical school. So you don't see doctors measuring nutrient levels very often. And so Myers himself began to realize that if someone had an undiagnosed nutrient deficiency, then the chronically ill patient would tend to stay chronically ill. Without that key nutrient, the cells were unable to complete the healing process. And so what we often see is people, when they're sick, they continue to be sick. Now, you can use medications to treat the symptoms, but very often the number of medications multiply, and the disability continues to advance in too many patients. So just simply controlling the symptoms is not the final answer, obviously. So our goal here at the center has always been to try to help people identify and treat underlying causes of many chronic illnesses. And so the idea that nutritional deficiencies, and now this expanded concept of nutritional dependencies, this has been helping us for now 34 years to help people who have otherwise been unable to get help to begin to restore health to their lives. The way this works is that, in a very simple way, you know, I'm going to use an example from my own research. How many of you take 500 milligrams of vitamin C a day, just as out of curiosity? Okay. Well, if we measured everyone's vitamin C level here in the room, we would see it be somewhere between 0.6 milligrams per deciliter to 2. So 0.6 to 2. And I imagine most of you would be somewhat in that range unless you've been really tired. We do see patients who are less than 0.6, and they truly do have symptoms of scurvy. Well, we here at the center, we've been looking for what we can achieve in terms of optimal serum concentrations. And so I did a research project here a couple years ago where I worked myself up to 32,000 milligrams of vitamin C orally per day. It was a special form of vitamin C, so I didn't have to spend all day in the bathroom, which was fortunate. It was actually very well tolerated, and I did it gradually. But I was only able to raise my serum concentration from, remember I said that the top number of normal here at the center is about 2. I was able to get it up to 5.7. But after an IV, we typically find of 15,000, so that's even less than what I took orally. But after a typical IV vitamin C of 15,000, we can see our patients easily achieve over 100 milligrams per deciliter. And with some of our cancer patients, we're shooting for 300, 400 milligrams per deciliter of serum concentration. So with IV nutrition, we're able to achieve much higher levels, which we think can help people overcome these cellular deficiencies. So by bypassing digestion, going right into the IV, we know we're getting optimal levels, and we don't have to worry about the issue of absorption, because sometimes you can take a lot of nutrients, but you don't always know how well you're absorbing them. So we think this offers a far more effective means to quickly and safely replenish cellular reserves of deficient nutrients. So over the years, several doctors all around the country have adopted the Myers protocol. And some of the things that we've seen improved by that approach would be asthma, migraines, general fatigue, chronic fatigue. Fibromyalgia patients can benefit. People who are having recurrent muscle spasms, there's quite a bit of magnesium in the infusion. The calcium in the magnesium is very effective at reducing muscle spasms. People who have been depressed and who have taken various medications and still are troubled with depression, this can be beneficial. Cardiovascular disease, arrhythmias, respiratory infections, seasonal allergies, drug withdrawal. We find that when patients are withdrawing from certain drugs, if they get one of these Myers, it relieves many of their withdrawal symptoms. Chronic hives, people who have hyperthyroidism, chronic viral infections such as hepatitis C, but even influenza or any type of chronic viral infection can benefit from the Myers. And certainly with cancer patients, we use the Myers in conjunction with the more higher doses of vitamin C that was pioneered here at the center by Dr. Riordan. So this leads me to this kind of a conclusion. And it wasn't just me, but there were people that were showing up at Myers Clinic who weren't really all that sick. And they had had one of these infusions and they noticed that they felt a lot better. It improved their sense of well-being. And it may be the fact that even though we're healthy, we're not sick, we may not feel as good as we can feel. And so by using IV nutrition, it's possible that you can enhance your wellness. And so this is where we enter into the notion that IV nutrition can be part of a wellness lifestyle. By having adequate and optimal nutrition, you can begin to slow the aging process. You might be interested in using it to improve athletic or job performance, but just to improve that overall sense of health and vitality. That can be a very beneficial thing, especially when you're under a lot of stress. There has not been a lot of research on using IV nutrition. Again, most doctors think of IV nutrients only for people who are unable to take anything by mouth. However, there have been research studies done using this protocol, and it's been shown to help with chronic fatigue syndrome, especially when the patient has magnesium deficiency. Even if you just give IV magnesium alone, there's about an 80% of the people will report improvement in their moods, reduction in their pain, and improvements in their overall energy. Magnesium is a key mineral when it comes to people who have diabetes. Very often you're depleted in magnesium, and this is why diabetics tend to be very tired. And I think a lot of people who suffer from fatigue, very often they're eating a diet that is refined and about lacking in the whole foods that are necessary for the magnesium. And then if you throw in the fact that magnesium is not absorbed very well, that's another reason why people have why they benefit so much from magnesium. So what we've done as part of our IV nutrition program out here is that we've taken this basic Myers. Are you all done? Yes. See, that was a quick. And we've augmented it. And so for people who are especially tired, we've added additional B5 and magnesium in order to enhance the production of ATP. For people that are suffering from chronic infections, we can add extra vitamin C. Selenium is very important in terms of retinal functioning, and so that can be added for people who have trouble with their vision or are at risk for macular degeneration. Calcium has a very nice calming effect on the muscles, and that's our IV Calm. Detox, we use additional glutathione, which is a very important nutrient for enhancing liver detoxification. And then zinc has been shown to be quite beneficial for clearing the skin. It has antioxidant properties. It helps clear acne. It can very much help improve the quality and the glow to a person's skin. So at this time, I'm gonna invite our two doctors from the center to come up and join me and open the floor to some questions, because I'm sure I've got you thinking about how can this be utilized in a way that can enhance how I feel, and what are the scientific aspects of it. And so Dr. Chad Career is our naturopathic physician, and chiropractor. And then Dr. Rebecca Kirby is a family physician and a registered dietitian and a research scientist. That's the two of them have been here for a total, I think, of about 15 or 16 years now. And so we've got microphones around, and if you have questions about IV nutrition, fire away. Yeah.
Hi, maybe I missed this, but is this lifelong or just until the level stabilize?
Is this lifelong, or is it just until the symptoms alleviate?
Yes.
I think it's going to depend upon the condition. I don't know, Chad, what do you think?
That's just, some people feel better when they have those every so often, so you may start out having those more frequently initially and then taper them off, and so it's definitely not lifelong, but it doesn't have to be lifelong. But a lot of people will feel better if they can kind of get a boost every once in a while. So let's say you're having sluggish digestion, or you're just not absorbing things well. While your doctor is working on helping your digestive process heal, maybe a good idea to get the IV nutrients. But let's say down the road, 3 months down the road, your digestive process is doing much better. You may be able to rely more heavily on oral supplements and diet, and you may feel like you don't need the IVs anymore. So it's just kind of a case-by-case basis, depending on what you're using the IV nutrition for.
So is it pretty much up to the patient as to how often they get these?
A lot of the times you work with your doctor and based on your symptoms, and they'll kind of come up with the program for you.
Thank you.
Yeah, we're not trying to portray this as come off the street and hook you up to the IV. It's we want you to come and visit with one of our doctors, and we spend an hour with our new lifestyle care patients in order to get to know what are your conditions, what is your past medical history, what are your goals, what are your objectives, and then matching that with what we know about the resources that we have here at the center, we can help you kind of identify which type of a program might be best for you. Okay. Any other thoughts or questions? Okay, here we go.
Go ahead. I wonder how much is covered by insurance, if any, and if it's covered at all, or what it is, how much?
I think Penny's going to address that at the end. Some of the insurance policies do cover it and some don't. And so it's at this point in time, it's a relatively new procedure. It depends on what your diagnosis is, and it depends upon what your insurance company is willing to cover on it. So it's I would just say at this point in time, it's not well established as far as which companies will cover what.
I have a daughter-in-law down in Dallas, Texas, who's recently been diagnosed with Parkinson's disease. And she came up to visit us, and just holding on to her hand, she has these tremors. And recently I've been doing research using IV glutathione.
That's correct.
From Dr. Whitaker's newsletter. But you need a certain amount of, much higher than you can take in a pill. Have you found a success, or do you use that IV for Parkinson's?
We do use IV glutathione for Parkinson's, and it depends upon how advanced the disease is with the patient as to what dose they're going to require. And we start out at probably at a similar level as what's in the IV detox, and then we gradually advance it depending upon the response of the patient. So, but we have used it here for probably 10 years. But that would probably fall into the category of chronic care in terms of Parkinson's disease is a pretty significant illness, and we would do additional types of tests on a patient with Parkinson's disease and not rely upon just IV nutrition alone. And I don't want to give the impression that IV nutrition is a standalone by itself type of therapy. It's a therapy that can be utilized both in chronic care and in lifestyle care as a means for people to improve their overall functioning.
Good afternoon.
Hi.
Hi. Was there a time in recent history, perhaps the last 100 years, when our nutritional sources were either strong enough or pure enough, and our toxic environment was low enough that we were able to have good and well health without IV and nutrition infusions?
Well, you have a valid point, of course. Not only has our food supply changed, but what we eat has changed. Just at the turn of the 1900s, we were eating less processed foods, less animal foods, and more whole grains and fruits and vegetables, which we're trying to get back to. That's, you know, the basic healthy recommendation. And then, of course, the blooming of all the chemicals and other things that we're exposed to sort of increase our need in some respects for many nutrients, which we may not be getting in the diet because we are eating more refined foods. But also, you know, we're not out plowing the North 40, walking behind, you know, horses. We're sitting at computers, so it's pretty hard in a lot of respects to eat the volume of food to get nutrients that you need. If you have a very good diet and you even are able to choose organic, your chances are very good. The average American, however, is not getting the RDA of nutrients, whether it be calcium or B6 or magnesium or any of the common ones we understand. So that may be why people, I mean, people died of infectious diseases back in the day when they're, you know, were eating probably less processed food and were more active. So the demographics have changed. Now we live longer to have the sequelae of a poor diet.
It's ironic that we live in a time where we walk into a supermarket or we go to a restaurant and it's like there's an overabundance of nourishment, and it appears in our culture that many people are suffering from an overabundance of nourishment. And that is true for the macronutrients, the protein, the fats, the carbohydrates, the calories. But what we're talking about today is that, ironically, in our culture, even though people are getting, in a sense, too much to eat, they're still starving from micronutrient deficiencies. And so the point that we're making today is that at the cellular level, if your cells don't have all of the right nutrients, that the team of nutrients that are necessary for cells to be healthy, you could have adequate calories, but still your cells are starving for certain key nutrients. And so the notion of using IV nutrition is a pretty recent notion. It's a pretty new idea to help people enhance their wellness and to help them get over chronic illnesses. So it's using it in both ways. But it probably is a very modern phenomenon that is unique to our time, that we have this kind of paradoxical situation where people are overweight and starving. So anyway, but what we're offering here today is another track, another means for people to, because there is a huge struggle. I know that so many people are worried about and concerned about their health and what to do, and people are out there jogging and they're trying to eat better, and in spite of that they're still having difficulties. And so IV nutrition adds another means of helping your body restore the nutrient balance it needs in order to function normally and in a healthy way. So any other questions or comments?
I see you list high cholesterol on here. Can it lower your bad cholesterol?
Cholesterol, it's one of the body's main antioxidants. And so why does cholesterol become elevated in our bodies to begin with? Probably because there's too much inflammation or too much oxidation in the lining of our arteries. And so cholesterol is sent there as an antioxidant, as a protective mechanism for our bodies. If you were to take antioxidants and getting IV vitamin C and the different B vitamins and things through the IV, that's one way of delivering antioxidants directly into your blood vessels. And so by delivering those antioxidants to the blood vessels, hopefully we're decreasing inflammation. If you decrease inflammation, then hopefully you can decrease the need for the high cholesterol in the first place. So yeah, taking antioxidants can be very beneficial for lowering cholesterol. It's one mechanism.
And again, we would like for you to think of this as part of a comprehensive lifestyle program, which would involve making better dietary choices that would include whole foods, that would include also oral antioxidants, fiber, learning how to relax and become less stressed. That reduces your overall bodily inflammation. There are special herbs and various formulas that can be used to reduce inflammation as well. So there's a lot of different ways to change your lifestyle in such a way that you're not prone to high cholesterol. So it's not just the IV nutrients, but it's IV nutrients in the context of kind of taking responsibility for your overall lifestyle choices. Yes?
How about vitamin D3? How much can be used on IV or regular supplement?
Dr. Kirby?
Well, we don't administer D intravenously, but you can certainly take it orally. You can get vitamin D3 supplements. You can take it by taking some cod liver oil. You can get out in sunshine like this in the middle of the summer at about noon. If you expose yourself without sunscreen for about 10 to 15 minutes, you'll make about 10,000 units. And it depends on how much you need it. That will determine how much you need to take. If you have a good level of vitamin D, you can maintain it with 1,000 to 2,000 international units a day, but to get to the optimal levels, it may take more, depending on where you are in your level.
The nutrients that are in the Myers IV are water soluble, and vitamin D is a fat soluble vitamin, so it can be taken by mouth just fine. Okay, here's.
Is there any record of vitamin C curing cancer?
Is there any record of vitamin C curing cancer? Well, that's been the mainstay of the research that the Riordan Center has been involved in for the last 15, 20 years. And so the word cure is interesting in the sense that we find that cancer seems to be part of the aging process. And so we haven't learned how to cure aging just yet. What we can do is we can use vitamin C as an adjunctive nutrient to help people with cancer be more successful in whatever therapies they're using to fight the cancer. And then using high-dose nutrition as the IV nutrition provides can also help protect your cells, strengthen your cells, and make you less prone to developing cancer. So all these nutrients we're finding kind of help repair the body. Most of cancer occurs because of damage and mutations to your DNA. And so nutrients such as the B vitamins and the vitamin C help do some repair work so that it makes you less prone for cancer. But we haven't got the research yet to say that vitamin C cures cancer, because cancer is very different in different people, and you have to individualize the therapy.
Thank you.
Mm-hmm.
What would be the main advantage to an IV therapy like this compared to like a Gerson therapy for fighting cancer?
Chad, you want to?
The Gerson therapy being a lot of juicing and coffee enemas and things of that sort. So I think we never tell people you have to do one way or the other, and we always try to take an eclectic approach, meaning that, kind of do a smorgasbord with people. So very much the Gershon's very much a whole foods diet, kind of raw foods diet, and getting the GI tract in optimal function so that you can absorb those things that you do take in. I think you can do both of those together and have a positive effect, both the Gershon and the IV vitamin C.
So yeah, it's usually when it comes to health, it's the both and rather than the either or. The question is, would using IV nutrition help someone that has an eating disorder such as bulimia or anorexia? Dr. Kirby?
Let's put it this way. When a person has an eating disorder, they are depriving their body of nutrients, either through the starvation of anorexia or the purging with bulimia. So getting intravenous nutrition with like IV nutrients would help replenish those that are lacking due to their eating behavior. Whether the behavior, that's the point. Those are eating behaviors. The actual behavior itself needs to be addressed as well. But as far as getting nutrients, getting an IV will help a person get more than they could orally. Just like we were talking about, where, you know, taking 15 grams of vitamin C orally, if your gut could tolerate it, wouldn't raise your blood level of vitamin C like taking 15 IV. And of course, when you put more than vitamin C in there, you've got B vitamins, the spectrum of B1, B2, B3, B5, B6, and a little extra B5, B6. There's folate, and then you get the magnesium in there. So intravenously, you can start replenishing your nutritional stores faster.
Also, another way to look at it is the IV nutrition is kind of a jump start. It'd be like a business that's failing and someone gives them a loan. They can't depend upon loans forever, but it helps them get back into a more healthy type of activity. And I think that's very much true for the IV nutrition. Many of the patients that we see, they're really down and out. They feel pretty hopeless. They need something to know that they can get better. And what the IV nutrition does is gives people a jump start, a quick experience that, hey, the body can work better if I have the right nutrients.
What's the youngest age that usually do proactive care?
What's the youngest age that usually does proactive care? I'd say in utero. Of course, that'd be the mother's proactive care, but I'd say the sooner the better now, and that doesn't mean we're going to be giving babies IV nutrition, but I think Dr. Riordan used to always say the younger you can get people interested in better quality nutrition, the better off they're going to be throughout the rest of their lives. And that's why, personally, I'm very concerned about what's happening to our youth in terms of prediabetes, diabetes. There's a lot of things happening to kids these days in terms of what they're eating that I think we're going to have ramifications for quite a long time. So,
have you ever had anyone that maybe had an allergy to vitamin C or any of the B vitamins?
Have you had anyone with an allergy with vitamin C or the B vitamins? Sometimes we have people that are reactive to maybe something like some component of it because it's put into various liquids, and we've had to get totally preservative-free B vitamins for some people. Most of the people, though, the B vitamins themselves, you're not going to be allergic to those because those are necessary parts of what your cellular machinery need. But not, it's like in certain vitamins, people, it's not the vitamins that they're allergic to, but it's the components that hold the vitamin together. So, yes, ma'am.
Yes. What about this therapy in relation to a person who's been told they have either a high staph count within their body or strep?
What to do for someone that has a high staph or strep or any kind of infectious count? Chad?
We know that vitamin C stimulates the immune system in at least 22 different ways, so it is it can be a great antibacterial, antiviral, so it is immune stimulating. So a lot of the times if you've gotten yourself into a situation with a bacteria that's pretty stubborn or a virus that's really stubborn, one of the best things we can do is IV vitamin C. Now we might have to do a little bit higher of a dosage than what we were talking about with these mini Myers, but that's something that would definitely be helpful.
A lot of people are concerned that, why would giving vitamin C through the vein be considered a natural therapy? And it's interesting that all living organisms make their own vitamin C, with the exception of humans, primates, and guinea pigs. And we used to make our own vitamin C, and we have the enzyme that actually converts glucose into vitamin C. But that enzyme, that gene has changed, it's mutated, it's no longer active. But when it is active, like in a goat where it is active, if they get injured or sick or stressed, they will increase their production of about 1,000, 2,000 milligrams of vitamin C up to as high as 20 or 30,000 milligrams per day if they're really seriously ill. And so we know in nature that ability of the body to respond to injury and stress by making more vitamin C is a natural thing that creatures in the wild use to overcome infections and whatnot. We've just lost that ability, and I kind of like to think of IV nutrition as kind of gaining it back in modern times using some technology that we've developed in our time. Yes, sir.
I had two questions. One was, what's the cutoff for pre-diabetes to diabetes? Is 120 on the glucose?
If you are over 99, then you're pre-diabetic. If you're over 125, you're diabetic. But those are just kind of relative numbers, and it's usually the trend that we're looking at with people.
Thank you.
Mm-hmm. Okay. One more question. Yes.
Dr. Sanjay Gupta did research and went into the homes in Mississippi because the people were dying left and right of cancer, young and old. He was shocked by what he found. Plastics all over the house. People put their water in plastic, put their food in plastic, and put it in a refrigerator. They carry their plastic bottles around when they go to the gym. They bring groceries home in their plastic bags. And you see these little kids playing with these plastic bags, and it is so dangerous. And yet, what is it going to take to get this information out to change the people's lifestyle?
Yeah, well, that's part of what the center is, and the clinic is devoted to doing is as an educational endeavor as well. We want people to become aware of the toxic elements in our life, and certainly there are many plastics and pesticides and various chemicals that we all have to confront. And frankly, back to your question earlier, why do we need IV nutrition? Because we live in a different world than our ancestors lived in. And frankly, nutrition is one of the last best means of strengthening ourselves to fight some of the stress and the toxic elements and the poor food that we all have to deal with in terms of living in this day and age. And so it's not the only way. I think there are a lot of different things you can do to become a more aware consumer and make better choices, but that is the essence of lifestyle care, is to help you be a better chooser, to make better choices that will help you be stronger and avoid some of these environmental mistakes that could be causing cancer and other serious illnesses. So, okay.
You said something about sugar and how and all the problems that it causes.
Okay, yeah, Dr. Kirby maybe will talk a little bit about the influences. That's a big topic, but the influences of sugar in terms of modern times.
Well, let's see. Let's just sum it up real quickly. Empty calories. You know, since we aren't out plowing the North 40, we really can't afford to eat calories that have no nutrients. And as American consumers, and I think it's probably worldwide now, we tend to over-consume sugar. It's the consumption of high fructose corn syrup, for instance, in the last 20 years has gone up 1,000%. So we're not actually benefiting from consuming foods that aren't giving us any nourishment. Besides that, it promotes inflammation and a whole list of other things.
Okay, thank you very much. I'm going to wrap up here with Penny Lassiter, who's our Director of Marketing here at the Center, to tell you about a special opportunity you have if you're interested in IV nutrition.
I want to give a round of applause to the doctors. I hope you guys feel like this was a very worthwhile lecture. How many people learned something today? I know I learned something every time I listened to the doctors talk. The last slide here shows a special that we have for people today. And if you're wondering, wow, this sounds like a great idea, I want to be involved in IV nutrition, how would I do that? We're running a special that you can sign up for. I have some blue forms for anybody who's interested. That we will do some blood work. We'll measure your creatinine and glucose level. You'll have a 1-hour medical history review with one of the doctors, which includes a mini physical, and you'll get the IV Essentials, which is the Mini Myers IV that you saw being given up here today, and that includes the vitamin C, the B vitamins, B complex, magnesium, and calcium, all those things. And as you saw, it's administered in less than 30 minutes. You can come, and it's a quick thing that you can do, and you can get signed up and get on a program. That's all today for $249, and like I said, we can take your name and number and give you a call if you're interested in it and schedule an appointment, or we can take your money today and get you signed up and get an appointment made. Is there anybody who's interested in that I can pass out a blue form to? Okay. Jen, you want to give those forms out? Well, it's about 1:05. We want to thank you all for coming. Oh, we have a drawing first. Yes, ma'am.
I just have a question.
Sure.
Is this special that includes all this extra little stuff, then if you continue having them a few times a year or whatever, is it that much again, or is it?
The question was, after you do the special, is there additional charge? There is additional charge, and it's dependent on the type of IVs that you get. If you saw this slide, you can choose immunity, you can choose energy, vision, calm, detox, skincare. So after your consultation with the doctor, you and the doctor may decide, you know what, I really have an immunity issue, and so the future IVs that you get would be customized specifically to the issues that you have.
And are they that much?
No, they are less than that. The special after the $249, if you're interested in doing multiple, what we call a package of IVs, the IVs are $100 each, or you can get 10 for the price of 9. So it's buy 10, get 1 free, or $900. We take credit cards. And like you saw up here, it's a very easy, simple process, even for someone who's a little bit needle phobic. I've had IVs, and it's a very easy, simple process. Any other last minute questions? Yes?
Daughter-in-law to come up here for Parkinson's for IV infusion of glutathione. How much would that cost, say, for 10?
How about if I talk to you afterwards, because I know Dr. Ron specifically felt like that was more of a chronic care case, and that's a different type of program, so I'll find you specifically afterwards. Okay? I'm going to do the drawing, and the drawing is for a $249 special. Let's see, I'm going to go deep. And the winner is Cora Schaefer? Cora, are you here? Stouffer. Sorry about that. Cora, congratulations. You'll get the $249 special. We want to thank you all for coming today. I have one quick last question. We've started to do newspaper advertising again, which is something we haven't done in a while. How many of you specifically came due to the fact that you saw the information in the newspaper? Okay, great, great. Thank you very much. Well, everybody have a cool day, and thank you so much for coming.